I'm Dr. Phil Tibbo, psychiatrist and researcher, as well as the director of the Nova Scotia Early Psychosis program. So our research program is focusing on the effects of cannabis use in youth and young adults, specifically looking at the effects on the development of a psychotic disorder. Schizophrenia affects about 1% of the population. If you look at psychotic disorders, that's about 3% of our population. So it actually is a fairly significant number. Historically, there's always been that negative association of schizophrenia having negative outcomes, and if you get a diagnosis of schizophrenia or a psychotic disorder, you don't have much future. And that was something that never really sat with me well. When I got involved with early intervention services and service delivery, really that became apparent that there is recovery. We're looking at what is the best treatment for our youth and young adults who develop a psychotic disorder, as well as looking at what are the barriers. I realized, actually cannabis is one of the main barriers here in this region within Nova Scotia. So we needed to not only develop and bring in treatment methodologies for cannabis use within this population, but as well as to research it more, because we don't have as much information as we need to inform our treatment and policies. One of the leading theories that we have in the development of psychosis involves connectivity. So the different areas of the brain connecting to each other to be able to work the way that it should. This connectivity is done by brain white matter. Now, what's interesting is that in development, our endocannabinoid systems are also involved with brain development during that late adolescent, young adult period, which is also the period, of course, where cannabis use can be quite high. So we're really trying to see, what is that link, and can we show that link between the cannabis use in adolescence and young adulthood, its effect on brain white matter, and subsequently its effects on psychosis development. It's very important for Research Nova Scotia to fund this type of research, not only in mental health, but as well as in researching something that's very topical today, and that's the effect of cannabis on mental health. While we are focused on effects within psychosis, keep in mind we're also looking at the effects of cannabis use on general youth and young adults in our community. Really what it comes down to then is getting that information to the youth and young adults. So that's the important bit, so that they can make an informed choice when it comes to cannabis use.